Our firm has a lot of experience handling obstetrical malpractice case. That's when something goes wrong during the course of labor and delivery. And unfortunately, the most vulnerable of our clients, the victims, are the unborn children who are then born with a significant medical problem. Now, there are lots of problems that can arise and lots of injuries that children can suffer. Here are the two most common, which are very similar, but there are nuances. The first one is a birth injury. When a child suffers an injury during some mishap during labor and delivery, failure to properly monitor, failure to perform an earlier C-section, those children can be deprived of oxygen. And that oftentimes results in something called a birth injury. A little bit different than that is what we call birth trauma. When we think about trauma, that can be physical trauma to a child. That if the child is not delivered appropriately or quickly enough, the shoulder can be stuck. There can be what's called a subdural hematoma or a hemorrhage of the brain. That's trauma. That's where something mechanically was done that caused excessive or inappropriate force. And that's what we think about trauma. So when families come to us with an injured child or an injury to the mom during labor and delivery, we urge them, especially in Florida because the law has got some real weird oddities to it, where you've got to move quickly, you've got to seek a lawyer's assistance and advice as soon as you can so that both the mom and the child can receive the justice they deserve.